I'm Danny. I'm going to be your nurse today. I'm going to begin by performing hand hygiene. I'm going to put my gloves on. I'm going to make sure your bed is locked. I'm going to pull the privacy curtain for privacy. I'm going to make sure all your tubing is entangled, your suction tubing is entangled, your IV tubing is entangled, and your oxygen tubing is entangled. I'm going to make sure I practice good ergonomics, and I have all my materials ready right here. Can you please confirm your name and date of birth for me?
Jacob Hansen, September 26, 1992.
Okay, thank you. And do you have any allergies?
No.
Okay. And do you know where you are?
Hospital.
Do you know who the president is?
Yeah.
Who?
Biden.
And do you know what day of the week it is?
Saturday.
Okay, awesome. I'm going to give you a times 15 on the Glasgow Coma scale, and patient is alert and oriented times 3. I'm going to go ahead and feel for edema. Upper extremities, lower extremities, no edema noted. And I'm going to feel your skin. Skin feels warm and dry. Skin color is appropriate for ethnicity. And I'm going to go ahead and check for tenting, or for turgor. No tenting noted. Capillary refill is within 3 seconds. Can you put your hands together like this for me? No clubbing noted. Okay, and let me feel for any. No lumps noted. And I'm going to go ahead and do your 10 pulse points. Temporal, carotid, apical, I'm going to listen for 1 full minute. Brachial, radial, ulnar, femoral, popliteal, posterior tibialis, and dorsalis pedis. Okay, and okay, sounds good. Now let's go ahead and start with the 12 cranial nerves. I'm going to begin with the first cranial nerve, which is olfactory. I'm going to put this under your nose and you tell me what you smell, okay? Go ahead and close your eyes.
Mint.
Okay, awesome. Now I'm going to do cranial nerve number 2, 4, 6. The second one is optic. The fourth is trochlear, and 6 is abducens. I'm going to begin by doing the 6 fields of cardinal gaze. Just follow my pen for me, okay, with your eyes only. Okay, awesome. And now I'm going to do the third cranial nerve, which is oculomotor. I'm going to go ahead and shut the lights off. Okay, awesome. And now I'm going to shut the lights back on. And if you can go ahead and follow my pen with your eyes only. I can see your eyes dilating as I go back. Pupils are equal, rounded, reactive to light, and accommodate. And now I'm going to go ahead and do the 5th cranial nerve, which is trochlear. I'm going to, trigeminal. The 5th cranial nerve is trigeminal. I'm going to put this on your face, and you tell me where you feel it. It's not going to hurt, okay? Close your eyes.
Cheek. Forehead. Chin.
Okay, awesome. And now I'm going to do the 7th cranial nerve, which is the facial nerve. If you can go ahead and wrinkle your forehead, puff your cheeks, smile, Awesome. And now I'm going to do the 8th cranial nerve, which is acoustic. If you can go ahead and stand up for me. I'm going to lightly tap your shoulder. Okay, you're going to close your eyes. I'm just going to check for balance. I'm going to count to 20. Okay, awesome. Go ahead and sit down for me. And the other one, I'm going to check for your hearing. And you tell me which ear you hear, okay? Close your eyes.
In my right ear. Left ear.
Awesome.
Peanut butter jelly.
Okay, awesome. And now I'm going to do the 9th, which is glossopharyngeal, 10 vagus, 12 hypoglossal. If you can go ahead and for me, stick your tongue out. Okay, awesome. Your uvula is midline. Patient is able to gag, and then if you could put your tongue towards one side, the other side. Okay, straight out, no deviation noted. And I'm going to do the 12th, which is the spinal accessory. Go ahead and shrug your shoulders. Awesome. 12 cranial nerves are intact. And I'm not sure if I asked you this or not, but on a scale of 0 to 10, 0 being no pain, 10 being the most excruciating pain, do you have any?
0.
0? Okay, awesome. And okay, from now on, let's go ahead and stand up for me. Actually, no, sorry. Before I forget, I'm going to check your eyes. If you can go like this for me, all the way down. Sclera is white. Conjunctiva is pink. You can close one side of your nostril. Breathe in. Other side. Nose is patent. I'm going to check your ears. No excess cerumen. No bruising behind the ears. No excess cerumen. No bruising behind the ears. And then your mouth, if you can go ahead and open your mouth for me. Teeth are intact and mucous membranes are pink and moist. Okay, go ahead and stand up for me. Let's begin. If you can take 1, 2, 3, 4, 5. 1, 2, 3, 4, 5 steps forward for me.
1, 2, 3.
Okay, steady gait. And now I'm going to inspect the abdomen. There is no hernias, there's no bruising, there's no stitches, there's no sutures, no moles, and no staples, no sutures, no hernias, no rashes. And if you can go ahead and face that way for me, please. And bring your hands down to your knees. I'm going to check for scoliosis. I'm going to start from the hairline down your spine. No scoliosis noted. I'm going to put my hands behind your back. Go ahead and stand up. And breathe in. Okay. Your lungs are symmetrical. And then go ahead and sit. I'm going to listen to your heart. The first point I'm going to listen to is the aortic. This is in the second intercostal space, the right sternal border. The right sternal border, and this is where the atrioventricular valves are open and the semilunar valves are closed. The second one is pulmonic. This is in the second intercostal space, left sternal border, and this is where S2 sounds are heard the loudest. The dub of the lub dub. The third is Erb's point. This is in the third intercostal space. Left sternal border, and this is where murmurs are heard the loudest. I'm going to use the bell of my stethoscope. The fourth is in the fourth intercostal space. Fourth intercostal space. 1, 2, 3, 4. And this is where the atrioventricular valves are closed and semilunar valves are open. This is in the fourth intercostal space, which is the tricuspid and left sternal border. And then the fifth is going to be the mitral. This is going to be in the medial to mid-clavicular line, and this is in the fifth intercostal space. Fifth intercostal space, I'm going to listen to the pulse for 1 full minute, and this is where the S1 sounds are heard the loudest, the lub of the lub dub. Okay, let's go ahead and listen to your lungs. If you could face that way for me, please. Okay, this is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You could put your hands on your hips. 11, 12, 13, 14, 15, 16, 17, 18. And then turn around, face me, please. 18, 19, 20, 21, 22, 23, 24, 25, 26. Okay, and now let's go ahead. Oh, and tracheal sounds are loud and high-pitched. Bronchial sounds are points 19 and 20 anteriorly high-pitched. Bronchial vesicular are points 1 through 6 posteriorly, 21 and 22 anteriorly moderately pitched. And vesicular are all other points low-pitched. Let's go ahead and have you, did I do strength for you? Okay, I'm gonna just do strength for you, and don't go, try to push in, try to push out, okay, and then go ahead and pull my fingers, hard, okay, and then are you able to put your hands out and your feet out? Patient is able to abduct, adduct, and upper extremity is full strength +5. And let's go ahead and have you lay down. I already inspected your abdomen, so I'm going to listen to your abdomen now, okay? I'm going to listen to the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Normal bowel sounds are 5 to 30 in 1 minute. Hypoactive sounds are less than 5 in 1 minute and infrequent. Hyperactive sounds are more than 30 in 1 minute, loud and high-pitched. And if vowel sounds are absent, I must listen to each quadrant for a full 5 minutes. Now I'm going to palpate each quadrant 3 times. Do you feel any pain or discomfort?
No.
Okay, abdomen is soft and no distension noted. And I'm going to go ahead and do, if you can pull your toes to your nose, press the brakes, toes to the nose, and do you feel any pain or discomfort? Okay, there's no redness, no swelling, and no DVT noted. And here is your call light. Here is your water. You let me know if you need anything. Going to practice hand hygiene. And let me just go ahead and do a quick run through to make sure I didn't miss anything. I did your 10 pulse points. I listened to your heart. I listened to your lungs. Inspected your abdomen. Listened to your abdomen. Palpated. DVT, no edema. I'm not sure if I felt your head, but head is symmetrical and there's no lice and your hair is clean. And I did your 10 pulse points. Okay, assessment is done.